So, good morning. Let's start our case discussion for today, and we will open with a fresh face, first year resident, and this will be our first case for the fresh year. This is a patient who's 68 years old, presented with fever and cough. And X-ray was done for her or him, I don't know. Her, I think. So, what do you see? Write her a report. Volume, so. Okay? Wahid, first of all, this is a chest X-ray PA view of an adult female patient. هاي الكليشة لازم مثل بالفارماكولوجي نوزيا vomiting diarrhea. إذا ما تقولها تتنقص، تقولها ما تأخذ ولا درجة. بس لازم تقولها. So again from the beginning. Okay. باي قولي adult patient لا تقولين old age لأنه الإكزامينر إذا عمره قريب راح يقلب عليك. زين؟ صح؟ وأغلبهم يعني هم فوق الأعمار متقدمة. So showing.
There's no homogeneous opacity involving both
لينا.
lung.
good. بعدنا من الصباحيات. There is a
Non-homogeneous opacity
Okay.
involving both lower lung zone.
homogeneous opacity involving both lower lung zone. زين كملي.
Okay. There's well-defined round
Okay.
lucent lesion involving the
Well defined round lucent lesion.
right mid zone.
Right mid zone. قومي راويني بس what are you talking أو لويش هذا ماوس يمك just tell me what are you seeing. Okay.
So there's also well-defined opacity involving right apical zone.
Okay.
Cardiothoracic ratio increased.
زين كملي.
Okay. Obliterated both costophrenic angles.
زين. Let's see عمتك لينا. Do you agree with anything she said?
Both no, right lower zone occupied zone.
No. Do you agree or هي دا تحكي في وادي والكيس في وادي آخر؟
شيخ.
تمام. عمتك تقول أنت في وادي والكيس في وادي آخر. So let's discuss them one by one. First, you said increased cardiothoracic ratio. Is it increased or is an expiratory full? It's an expiratory full. So not increased. هاي أول شغلة. شغلة ثانية قلتي obliterated costophrenic angles. Is it obliterated? هذه obliterated.
لا ما تقول expired.
زين هذه لا حتى مو expiratory هذه obliterated. So they are not obliterated. فهاي النقطة الثانية. بعد ايش قالت؟ opacity بالboth lower lung zone. Where is it؟ ايش لي عليه؟
Non-homogeneous opacity.
ايه اللي
And
يجي.
I feel it. There's non-homogeneous lower lung zones.
زين. طبعا they are normal.
Okay.
Okay.
ما تقول expired في
زين. ايش بيها الحجية؟ دا اقول لك جاية تقوح ومصخنة. ها؟ وين نيموني؟ انت diagnosed on a clinical عاد شو كنت ازيها اكس راي مو محاسبه المريضه ما ادري ايش قد. ها. So There is no opacity here. Is there any opacity here or not? Here. Look. This okay. This is what? شنو هذه؟ حتى نخلص من هاي السالفة. What's this?
The medial end of clavicle.
Medial end of clavicle or maybe a little of retrosternal goiter. هاي انتهينا منه. So that's not our concern. High opacity لو لا. Compare with this side. Compare the right with the left. Is this an opacity or not? هذا line. هذا diaphragm. صح؟ هذا diaphragm. Compare with this side. This is a diaphragm. And what about this? How do you describe this? مو قلنا normal cardiaphonic angle. This is an airspace opacification of the right lower lung zone. What's the distinguishing feature here? It's silhouetting what? Is it silhouetting the diaphragm? So, indicating this is a you said silhouetting the right heart border. So this is a right middle lobe pneumonia. Okay? Got it? Agree? Yalla. Next. Susu. Susu ya Susu. فرموا. طبعا اكيد old age وسموكر but since as long as it is expiratory you cannot judge. سوي proper inspiratory بالضبط. This is a 47-year-old female patient presented with cough and fever and يعني هاي الشغلات. Start. اعطيني فوليوم. عافية. PA view. Adult female patient showing
homogeneous opacity in the right lower zone.
روح. Good. كمل. Homogeneous opacity in the right, middle and lower.
Middle and lower.
Okay, good. انطلقي ماشية صح. Right.
Right costophrenic angle.
احنا نحكي على الاوبليتريشن للكوستوفرينيك انجل. نشوف opacity. Obliteration of the costophrenic angle means pleural effusion او pleural thickening. زين. احنا هاي الاوباسيتي is it an effusion?
No.
It's not an effusion. So هاي نشيلها. فعندنا opacity بالرايت middle and lower lung zone. ايش بيها هاي الاوباسيتي؟ silhouetting what and not silhouetting what? Not silhouetting the cardiac border. Excellent. Silhouetting the what? The diaphragm. حلو. من نمشي scientific نمشي in a very nice way, indicating that this patient has what?
Lower lobe.
Which lower lobe?
Right.
Right lower lobe pneumonia or consolidation or airspace opacification, whatever you like. That's it. As simple as that. عكس الكيس البريفيوس كانت middle lobe هسه lower lobe. ذاك silhouetting the heart هذا silhouetting the diaphragm. ما حسيتي شوفي more cases حتى تحسي. ها؟ Some kind of pleural effusion with inflammatory, who cares? بس احنا we do not say silhouetting the cardiophrenic the costophrenic angle. Obliterated or not.
بس دكتور هو اذا الانجل اوبليتريتد هسه احتمال من السلوتينج هو هيجي مبين له عنده انفيوجن لان هسه الكوستوفرينيك
As for me I would say from the consolidation, not pleural effusion is difficult to judge, especially if mild on lower lobe pneumonia. It's difficult على right وعلى left. Okay? Good job. تمام؟ تعلمنا الفرق بين الميدل لوب نيمونيا واللور لوب نيمونيا؟ Good. Hello. هسه خلصنا هاي يسموها warm up film. هذه احماء.
Next step, need the lateral view or judging?
Well, you can do lateral view, of course, to confirm, which is a good step. Or, as far as I'm concerned, give a treatment and repeat X-ray. Why give the X-ray exposure? I'm almost 95% sure that this is a lower lobe pneumonia.
هذا كلينيكال.
وذا كلينيكال طبعا كف وفيبر ومدري شنو. صح ولا لا؟ زين. نصعد شويه العيار. لا معود هيبه
لا باقي لها 3 شهور بعدين تصير سكن.
هيبه وعلم.
لا قلت لي
خوش كيس. خوش كيس. عندي كيس مال واخري عن الماوس. يعني واخري عن الماوس مخصوص للي ما يخلصون الفيديو مال اليوتيوب. So, this is a 30-year-old female patient presented with bleeding. دقيقة لحظة أوقف. Don't. Let's start with the first. Presented with vaginal bleeding following a procedure. She doesn't know exactly what is it. Someone did something to her and she started with pelvic pain and bleeding and things like that. So at ultrasound looks abnormal. So MRI was ordered. And this is a case you can see in the clinic very likely. ممكن بسهولة تجي في الكلينيك. انت عندك كلينيك مو؟ عندك كلينيك؟ يلا راوينا بالكلينيك شو تسوي؟
كورونا.
هاي على اليوتيوب الكل يسمع المقيمين.
يوتيوب كورونا MRI في 30 years old female.
T2 weighted image.
T2.
صح؟ لو T1
لا
T2 تمام.
T2 weighted image.
صوت انت صارت خجولة ما يطلع صوتها. Showing. This is T1 بس هاي T1 post contrast I think. Yes, this is T1 post contrast. طبعا السيكونسز يعني شو نقول راندوم مو ارينجد يعني حسب التسلسل خلينا نقول. يعني جوا راح تلاقين بعد صور. لحظة صبرش عليه. Leave the mouse. Where is it? شنو ما جاي بس الكونتراست؟ يلا مو مشكلة عندنا T2 عندنا كونتراست no problem. I don't know why something happened in the copy but anyway.
It's heterogeneous lesion occupy uterine cavity.
Good.
Which is خليني أشوف
So there is a lesion heterogeneous on T2. Where is it located?
It's hyper in T1.
لا, this is post contrast. This is enhancing on T1.
It's occupying endometrial cavity.
Okay.
ممكن هذا endometrial cavity.
والله ما ادري ايش ما ادري اليوم. So
This is blood seen inside endometrial cavity.
okay.
The wall is occupied is a non-homogeneous myometrium, heterogeneous myometrium fibroid, make fibroid, multiple fibroid. This one, this another one. shows intense enhancement.
اوكي.
Post contrast.
هي المشكلة ما ادري ليش ما جاي لي باقي السيكونسز. I'm surprised صراحة. Anyway. So, what should you write to the patient? What does she have, or what would you recommend, or what's your differential?
To me, it's multiple neural fibroids with endometrial blood clot inside endometrial cavity.
زين what does that indicate؟ يعني blood clot الجابه الكبرى بالendometrial cavity.
مو سوت أني فشي international
زين.
وعندها vaginal bleeding. يعني معناتها عندها heavy bleeding عندها عندها clot
اوكي.
داخل endometrial cavity.
اوكي.
والفايبرويد هنا.
So what should I tell the referring physician? زين. خليني أعطيك hint. She had a completely normal pre-procedure ultrasound. شنو رأيك؟ يعني قبل أسبوعين سوت ultrasound كان look بالباكيت absolutely normal. لا فايبرويد ولا كلوت ولا كل شيء. She's 30 years old, young female, with a normal uterus. This is expected. So,
So in injury she
ما أعرف أنت قولي لي. What do you think? How do you link these findings together?
يعني إذا مسوي perforation
Before the procedure يعني.
إذا مسوي perforation uterine wall
إيه. So,
مسوي blood clot injury
clot where? Endometrioma تقول. Do you agree?
هذا
In 2 weeks, this big? لو شنو Grandizer? So, since you are already there, first of all, leave the mouse. You can see that this is the endometrium, definitely, okay? And you can see that this is not a fibroid. You can never have a fibroid that is, I don't know, semilunar in shape and with this heterogeneous signal intensity. And you can never have this big lesion, a fibroid in like 2 weeks, مثلا, okay? And since our history is post-procedural complaint, if you see on the post-contrast, you see the active bleeding here. Do you see how the contrast ده يطلع يجي للإندومتريوم? Okay? And you can see this abnormal thing that is enhancing post-contrast. Let's go to the coronal image and you can see again the active endometrial bleeding, and you can see this lesion is surrounding the dilated endometrium. So this patient with a simple history had an illegal abortion by a midwife in a house somewhere, I don't know where, okay? And the midwife, what she did is completely ruptured the uterus, resulting in subserosal big fresh hematoma. When it's fresh,
مثل pseudo-aneurysm.
exactly, it's kind of pseudoaneurysm, and since it's fresh, it's enhancing, okay? And this is a clot with active bleeding. So it was a big emergency.
يعني هو احتمال الهيموريد بس موقفها هذا
Cirrhosis.
container هذا
Yeah, it's contained in the
مثل
uterine cirrhosis, let's say.
يعني تقريبا
Okay.
ترانيورال هيماتوما بس
هو transmural rupture. Transmural rupture, لا تتعب روحك. شوف هسه هاي هنا. This is the site of rupture, I think, and this is a fresh blood, and this is the clot with active bleeding.
ونتابع
يعني
الهيماتوما
السيروزا
قديش
باقي.
contain-
سيروزا ولا ما سيروزا كان
اي يعني متابعة discontinuation بالوضع.
exactly. Okay, so this is a very interesting medico-legal case of illegal abortion, and you can very nicely see the rupture here. See, by هنا راح أوخر الماوس شوفي there is discontinuity of the endometrial lining leading directly to this
تقريبا
lesion.
ligament باقي ويصير peritoneum.
exactly
ليه discontinuity هذا رينيا؟
ربط ستر وما زفت
الهيماتوما عادة لو برا لو يعني inside fibrosis or outside وزناته تكون مثل side sibelius. باقي خطوة ويصير مزيد.
so يلا ريا وسكينة زين اوكي This is a case of a 20-year-old female patient with thigh swelling. Yeah, long standing. شنو هذا السيكونس الغريب هذا؟ This is alkalizer. So why you are wasting my time with it? Yeah. هذا شنو؟ previous surgical intervention by the way. لا localizer نية. No localizer, not, this is a sequence. This is a T2, fat saturated, sagittal image of
knee joint.
طلع لساني قامت تحكي اي لا لسان كلش of the knee joint showing اصبر نياس صبركم خلوها تشوف and the lower thigh okay showing a what
هذا screws فمسوي
metallic screws metallic artifact of the femur اوكي شوي يعني causing metallic artifact اوكي امنت بالله بعد هسه عرفنا عندها سكروز زين شنو السالفه كم هذا لوكلايزر هم يعني تركي او بلانت بالحقيقه مو لوكلايزر whatever who cares leave it go down بعد انزلي بعد روحي على هذا هذا عدد الصور اللي 23 يعني it's a real sequence when it's 3 images 2 images this is a localizer so now it's an MRI of the hip or pelvis and both thighs showing يلا هنا أنا عندك شنو يلا give me something speak don't stay silent tell me what do you see right or wrong I don't care just say there is this and there is that soft tissue swelling previous surgeries long duration years I have no idea to be honest
There's high signal T2 intensity at region of left
شلون كيسات؟
هذا شو مسوين بيها؟
لا لا ما مسوين بيه شيء. This is not a medical error. This is not a medical mistake. يا معودة وحنان tell me something. Good.
هذا
بعدكم first يا معودين. calm down. اهدوا.
low signal on T1.
حلو. ايزو انتنس ما نقول له يعني it's the same to the muscle تقريبا. What about T2?
High.
Per intense. Good. To muscle.
Yes.
What's the hyper intense or the what is it?
Hyperintense in T2 means fluid.
ها
يعني edema.
يعني مثلا الكانسرات تطلع هايبو بالتي مو
لا
هايبر انتنس معناها هايبر انتنس ممكن فلويد ممكن تيومر ممكن ابسس ممكن انفلاميشن ممكن it's a huge differential diagnosis it's just a criteria مو كل هايبر انتنس معناها فلويد زين so there is من البدايه خلينا نركز there is a what
ill-defined
ill-defined
high T2
عوفي هاي T2 هاي ill-defined what
ill-defined abnormal signal
ما تقولي
intensity
abnormal signal intensity شنو abnormal signal intensity ill-defined lesion
lesion involving
ill-defined lesion there is a lesion there is a space occupying something okay that appears
high on T2 and low on T1
hyperintense on T2 or iso-low on T1 حلو what does it involve
involving the
gluteal
left
muscles left side عفوا left gluteal and extending into the pelvic floor muscles this is through the sciatic notch extending to the pelvis and involving the gluteal muscles انزلي جوا بعد زين طلعنا T2 فات صار كان more hyper intense and easier to see فوق وين بعد اوكي هذا فوق the first one yep now it's involving the gluteal muscle it's extended to the pelvic floor it's
Thigh
involving
muscles.
the thigh muscle where exactly the thigh muscle take this one where the thigh muscle see you can see it's involving the gluteals انزلي and extending through the sciatic notch into the pelvic pushing the rectum to the other side to the right side انزلي and it's involving what the thigh muscles انزلي which thigh muscles exactly mainly on the lateral aspect and posterior aspect انزل شوفي the which compartment is that the flexor compartment of the thigh okay انزلي all the way to the level of the knee تتذكرين بالبدايه شفنا الني
هو دكتور اصلا ما كان اكو هاي السيجنال on the bone as well بالبدايه
هو تصبري احنا what happened is they ordered the knee MRI we do a knee MRI there is a lesion اصعد فوق للثاي بعد الليجن اصعد للبلفس بعد الليجن يعني we are doing شو نقول نشوفه نصعد اوكي الى ان توصلنا الى انه هو من البلفيك and previous surgery in the thigh اوكي زين now لحد الان we are describing wait well the fact is to be honest since the diagnosis known previously she has something so they wanted just the extension not so contrast was of no need in this case okay I have the extension so such a lesion okay with the extension from the pelvis شوفي إلى الكني it's irregular it's infiltrative it involves multiple soft tissues with almost no bone involvement, at least in these images. We don't see any bone involvement, okay? اكو finding كلش مهم بس لحد الان ما حد حلها عليه. لا تحركين كل شيء.
موجود هذا.
What is a finding that can help us narrow the differential diagnosis? Here. يعني نقدر نقول هنا. Anybody? What are these? Oh, sorry. Just a second. وين راح هذا Let's. I'm scrolling and see and tell me what are these skin hyperintensities, especially like this one, for example. What are these? The previous surgery was at the level of the knee. These are high, at the level of the thigh, or maybe upper thigh, lower hip. What are these?
Maybe fat necrosis.
Fat necrosis. No.
Vein, dilated vein.
Dilated
Vein, little superficial.
no veins. Feeders.
Feeders.
These are vessels providing blood to the lesion, indicating that this is a highly vascular lesion. نشوف blood supply شكون هنا؟ What's your diagnosis? هو واحد ماكو غير. ها. The bone is normal. AV malformation. We are going close. Angiosarcoma. It's a possibility, but there is no signs of malignancy. The bone is intact, no lymph nodes. The muscles, other than the posterior compartment, are good, and there is relatively little. So, يعني edema. التيومر راح تلاقي edema، صار عندك edema. بعد. يلا. يعني you are not يعني شو أقول بهالمكان بهالتريتوري. It's an extensive soft tissue hemangioma. From up to down, big, huge soft tissue hemangioma. That part of it is resected and most of it is left, and you can see it's replacing the muscle by dilated vascular channels with huge feeders from the skin to the lesion. This is touch it and she'll bleed to death. دير بالك تسوي بايوبسي. Embolization, surgical step-by-step intervention, whatever. مو يمي الأشعة.
الغريب بالموضوع انه اكستنشن مالته
It's you هو هذا اللي ترسكين بالكيس. كيس من pelvis بالني ما صاير.
ياتروجين
لا.
كان عندها
هي كان عندها قبل الاوبريشن.
هم resected part وباقي part.
يعني ليش عندها فيكسيشن؟
هو مسوي له ريسكشن كان involving البون كان abnormal فمسوي له ريسكشن ومثبت. بس هم شنو عايفين a large part of it, so they want to follow up procedure to try to minimize it. Her legs swollen just like big. صح؟ huge extensive soft tissue. دائما هذا الابيرنس حطه ببالك هيمنجيوما. ليجن بس لا هو rounded لا هو oval لا هو هيك space. It's just dilated channels. Sorry? Chondrosarcoma, the bone itself should be abnormal. But if you see here, the bone is basically normal. There's nothing wrong. الساعة 9. Okay. هو involving everything. Thank you very much. Good job everyone.